As we mark Breast Cancer Awareness Month, we are taking a look at some of the treatment options available for local patients at Rochester Regional Health. We're joined by oncologist Dr. Farhan Imran this morning to talk about that. And the good news is there are new and better treatments than there were decades ago, right?
That's true not only for breast cancer, but multiple other cancers, but specifically breast cancer has been a success story in oncology. And a lot of credit is given to early screening and early detection, because everybody knows that the earlier you can detect the cancer, the more you can do about it and the more the outcomes are really good. So with the excellent screening techniques and with women going in, you know how many women come to us and they say, well, I've been having mammograms, but they hurt or it's inconvenient. Or some women may say, well, I have mammograms very regularly, but they did not detect my cancer and it was detected by some other way. But despite all those inaccuracies in the technique, it's still a success story that the earlier the cancers have been found, the more treatment options there are nowadays and the better the prognosis is.
So in terms of treatment, I know like just if you are found to have or diagnosed with breast cancer, it can be very complex and there's a lot of information that can be overwhelming for patients. Where do you start in terms of treatment? And I imagine maybe it just depends on a person's circumstance, right?
So to you, what may sound like breast cancer is our whole world inside of there. So from the moment that a lump is detected, there's so much study that we do for each individual patient, something called personalized medicine, where when the biopsy is taken, it is looked at under the microscope, and there are so many tests done on it. There are genetic tests done on it. We check for mutations, different markers, and really for every individual patient, a very tailored plan of treatment is put into place, where typically treatment starts with removing the cancer by surgery. And the surgical techniques have also improved dramatically over the years. There was a time that surgeons used to think that the more breast tissue that you take out, even disfiguring surgeries, the better it is. But in today's day and age, those scars have become very small, something called lumpectomy. Then next on comes radiation. And then it comes on to what we call systemic therapy, which are treatments which reduce the chances of the cancer coming back. And within that realm, there are a number of different treatment options that we have available, which include chemotherapy, which include hormonal therapy, which is anti-estrogen therapy, and also for certain kind of cancers, these smart drugs called anti-HER2 treatments. So there's so many treatment options that there are available. So if it's an earlier stage breast cancer, the numbers of cure are excellent. It's a very curable condition. But even if it has spread and if it's incurable, again, the treatment options are plenty and the prognosis is much better than some of the other cancers.
It's incredible. So there's so much hope that can be had.
Absolutely. The message that I would bring today would that be of hope in breast cancer.
And you've got your mobile imaging unit out there right now, delivering that mammograms to all women all over the city.
Absolutely. And I don't know the financial ins and outs of it, but from my understanding, it may cost many women nothing to just go and get screened. So I tell people, well, if you're going out and if you're making a decision to maybe buy something or maybe eat something and you put in an effort to make a reservation at a restaurant, why not make an effort and spare about an hour or two of your time to just go get screened to save your life?
Yeah, make it a priority.
I love that. That is so wonderful. Dr. Imran, thank you so very much. It is wonderful to have you in studio with this wonderful message of hope, especially during this month.
Thank you for having me.
Thank you. All right.